Dear colleagues, I'm very pleased to be able to pass on you some experience on the subject of migration and health from my time as cantonal doctor in Canton Aargau and Basel-Stadt. I have been working in the health sectors for over 30 years and have gained a lot of experience in the field of migration and health. I think some of this experience may also be useful on the topic of viral hepatitis and migration. Let me first make some general remarks about migration and health. My first comment is very important for understanding the statistics. Switzerland migrants population is heterogeneous. A small share can be found in groups with a higher income and higher level of education, whereas most of the migrants in Switzerland have a lower level of education and a lower income than the population average and are more often affected by poverty, unemployment, and health problems. Many of these migrants have particular health problems. For migrants living in Switzerland, the main problem areas are the following: higher newborn and infant mortality, higher rates of abortions and complication in pregnancy and birth, higher maternal mortality, poorer dental health in children and adolescents, more frequent infections with sexually transmitted parasitic and other communicable diseases, more mental health disorders, more occupational problems, greater risk of accidents at the workspace, and a greater risk of disability. Compared with the native population, migrants who have been living in Switzerland for some time describe their own health as significant worse. Old persons and females are particularly exposed to the health problems. In addition to acute disease, more health risks are also present in migrants. Some examples of these are the state of health is below the national average. There are a lot of special health risks. For example, little sport, increased tobacco consumption, increased obesity in children, stress and psychological strain, viral hepatitis, and other communicable diseases. In terms of health behavior, there are also major differences between migrant sector and Swiss population. Migrants often have inadequate knowledge about healthy behavior, and they frequently experience communication problems in their interaction with healthcare institutions. There are major differences in diet, in exercise habits between the migrants and the native population. On average, migrants have less healthy behavior patterns. Another problem is communication problems. An estimate 200,000 persons living in Switzerland do not understand any of the national languages. This does not include those who will be able to hold a everyday conversation need language support in more complex conversations. Around 700,000 persons do not speak any Swiss national language as their main language. Direct communication with the doctor poses problems for a significant number of these people. Persons in asylum sectors have been greater comprehension problems. But there are several other reasons why this health inequality is coming. These points are particularly central. Migration-related factors, because every migration is also a rupture of the history of life. Socio-economic situation, migrants also tend to have fewer financial resources at their disposal. Then knowledge on health issue is often lacking. And there is a lack of knowledge in dealing with the Swiss healthcare system. So, what are the challenge when you want to bring more health literacy, in our case, on the topic of hepatitis treatment and prevention to the migrants population? What do we have to take in account? Here too, as always in the prevention, we have to consider the behavior and the circumstances. So it's not enough to distribute, for example, translated flyers. We have to reach into people's life. One of the great challenge here is the diversity on the Swiss health situation. It always reminds me of the Swiss exhibition stand at the World Fair in Sevilla. It has the motto Suisse n'existe pas, Switzerland does not exist. There are many elements that make up Switzerland. In the same, in the healthcare system. The healthcare system in Switzerland is complex due to its historical development. In addition to the confederation, cantons and communities, private sectors such as the health insurance companies, hospital and professional association playing a major role. And in addition to this political and professional system, there are many other factors that can influence the intervention. Public opinion, the economic situation, the media, etc., may play a role that needs to be taken into account. The care of asylum seekers is even more complex. Here there are special legal frameworks, conditions that have to be taken into account. The two presentation slides only give a little impression of this. I cannot go into detail here. In case of the socio-medical intervention, the cantons have a key role in the practical implementation if financing of additional services become necessary. Against this background, I can introduce some example of my earlier work. For the target intervention, one must know where the problem lies. For this reason, the federal government and various cantons regularly analyze the health situation of the population and of the migration population. There are some illustrative examples from the canton of Basel from the last 50 years. Here you can see one of the overweight of the people divided according to different nationality. We see clearly more migrant children with overweight, but there are also differences between the migration groups. Another example is here. Here are two statistics on health behavior. We can see that there is less contact with the pediatrician among children with migrant background. There is also fewer vaccination, preventive checkups, and the migration parents go more often with the children to emerging ward of the children's hospital in case of illness. Another example is here. These are two statistics from the field of prevention. In this school medical survey, we were able to show that children from migrant families often spend more time with TV and computer games, and also have such devices in children's room more often. This also explains why these children spend less time exercising. We find such difference among adults as well. Here are two examples from the canton health report. We saw, for example, here that the migrant population is less vaccinated against influenza and less likely to have a blood pressure check. We also find this difference again and again in the topic around communicable diseases. For example, here, more children with a migrant background did not know that you can get vaccinated against hepatitis B. Against this background, it's unfortunately not surprising that apparently the vaccination offers during the corona pandemic were used less by migrants overall, and that more several cases occurred in the migrant population. Unfortunately, exact features are likely lacking here. You see, we see from our health statistics a wide variety of challenges in the area of migration. We know that the best way to achieve positive changes is to be active both in individual behavior and in the area of circumstances. Here are some practical examples of that. In 2022, for example, we had to assume in Canton Basel-Stadt that foreigners has significantly lower vaccination rates than the rest of the population. We analyzed the situation together with our contacts from the migration sector and especially increased vaccination promo with voice messages in already existing social networks and with the help of people from the cultural circles. At the time, around 100 interpreters were on duty, and we learned a lot about possible inhibiting factors. For example, a common concern among migrants was that the vaccination would not really free of charge, but that there will be a high bill afterwards. An aspect we didn't think on at start. It would be ideal if you could be beyond a medical offer that can reach out to the migrant population. We have successfully done this for many years, for example, with the school vaccination program, which has led to a clear improvement in vaccination rate. There is an old analysis of that showed that the level of vaccination among young people depends on whether there is a school vaccination program in the canton or not. What about transmitted flyers for information? Does that make sense? Written material for distribution or on internet is undoubtedly an important knowledge base. But publishing is not enough. We have that principle that such products should always be linked to authors. For example, the information campaign on postpartum depression was simultaneously linked to trained for midwives. For the information material is actively used by interpreters who address migrant parents in the park directly or at the events on the individual migrant groups. In this way, medical topics can also be communicated well. For example, we organized a successful search for possible bone marrow donors with a migrants association as part of a large event. Special offers for migration are also helpful. For example, the association Gesünder Basel regularly organized swimming and cycling for migrants on behalf of the canton, and those reach more people with a migrant background. So I come to the end. I hope that you gained a little insight into the challenge in the field of migration and health. And I'm already coming to my taking home message. It is very simple. If you want to be successful in the field of migration, you have to get close to the people with the topic and the offers. Actually, this is true for the whole population. Thank you very much and good luck with this important job. Thank you very much.